My name is Kath Bainbridge, and I head up the Rare Diseases and Emerging Therapies team. We're a DHSC team that sits within the Office for Life Sciences. And we are a policy team. We look across the entire system, so all the way from research through regulation and into service delivery in the NHS. And we have policy responsibility for rare diseases, so that's primarily through the UK Rare Diseases Framework and England's action plan, but we also hold responsibility for wider policy around emerging technologies associated with human genetics. So I'm going to talk you through today 4 key points. So firstly, I'll recap the UK Rare Diseases Framework. I'll talk about England's action plans, which help us to deliver against the priorities of the framework. I'll focus on pioneering research for rare diseases, which is one of the cross-cutting themes. And finally, I'll talk about what is set to follow. So usually I have a slide here that explains to people what rare diseases are, but for this audience and following the introduction today, there's really no need for that. So we're all brought together through our shared work on rare diseases. But one thing that I think is worth saying as part of the introduction is that when we talk to people who are less familiar with rare diseases, I find it is always worth emphasizing that point around how collectively common they are. So this is not a small challenge affecting a small number of people. There are around 3.5 million people in the UK living with rare conditions or who will develop a rare condition at some point in their lives. That is the same number as the number of people living with cancer. So this is a huge challenge, and there is enormous unmet need. We've already heard that 5% figure, only around 5% of rare conditions of over 7,000 have an approved treatment. So there is a huge challenge here, which we are collectively committed to addressing. So the UK Rare Diseases Framework was published in 2021, and it was built off the back of the national conversation on rare diseases. So this received nearly 6,300 responses, and it helped us to identify the 4 priorities of the UK Rare Diseases Framework, which are faster diagnosis, increased awareness amongst healthcare professionals, better coordination of care, and improved access to specialist care, treatment, and drugs. And sitting alongside those 4 priorities are our 5 cross-cutting themes, one of which, circled in red, is particularly important for today's conference, so that of pioneering research. As well as those 5 cross-cutting themes, in England we've introduced a 6th theme, which is health equity. The framework is in England. It is delivered by partners across the health system, so primarily public sector partners who help us to develop actions against those priorities and to deliver on them. Within the framework, there was a commitment for each nation to publish an action plan within 2 years, setting out how they would deliver against the priorities of the framework. All 4 nations have done this. In England, we have a commitment to publish an action plan every year during the lifetime of the framework. Because rare diseases are rare, that collaboration across the 4 nations is really important. So health is, of course, a devolved matter, but it's really important that we work together because of the small numbers of people living with each rare condition. So the picture here shows significant buildings lit up for International Rare Diseases Day across the 4 nations, symbolic of the way in which we work together across the 4 nations to deliver change. So I'm going to talk now specifically about England's rare diseases action plans. We've now published 5 action plans during the lifetime of the framework. The most recent came out just ahead of International Rare Diseases Day on the 27th of February this year. Altogether, we've now introduced 40 actions against the 4 priorities of the framework, and 19 of those remain active. So we have actions across our different delivery partners, and we continue to push ahead to deliver these. This year's action plan starts off by setting rare diseases in the context of the 10-year plan for health. Now, the 10-year plan for health, enormous for healthcare in England, and it brings in these 3 important shifts which are going to be transformational in delivering change across the health system, including for people living with rare conditions. And in the action plan, we describe how those changes are specifically going to benefit and align with the needs of people living with rare conditions. And we're beginning to see the changes that have been set out in that 10-year plan come through. So if you look at the recently published neighbourhood health plan, for example, there is so much in there that's going to really drive change for coordination of care for people living with rare conditions. So lots of opportunities to engage with those broader initiatives as they move forwards. This single slide summarises an awful lot of progress which has been made during the last year. So we've just heard from Lawrence about the really transformational steps that MHRA is taking to rewrite the rule book for rare diseases. We're seeing a responsive, innovative regulator who is committed to proportionate risk assessment for people living with rare conditions, and that is fantastic to see. That demands a system-wide response, and within the department we're looking now at how we can bring together the different parts of the system to make sure that that change is wrought across the entire system and joined up. We also saw that NICE published their Rare Diseases Quality Standard on the same day as our action plan, so that's come about through a lot of hard work with the rare diseases community. And this quality standard is really excellent to see. It is going to drive up standards of care for all people living with rare conditions. It's not condition specific, but there are these common standards which can help to drive change. We saw progress from NHS England in developing their individualised therapies operational framework, and alongside that, a really active system built off some of the research investments, but also including the Rare Therapies Launchpad. So lots of change and lots of ambition happening there. And we were really pleased to announce that we've secured the funding to open this year 2 centres for people with undiagnosed conditions. So NHS England is currently working to get those stood up. And finally, the reprocurement of the genomic medicine service with a focus on reducing that diagnostic odyssey for people living with rare conditions. Up on the right, you've got some of the progress in numbers. We've got G-Notes. We've got the generation study, which is now well up and running. We've got G-Notes, which is putting information at the fingertips of healthcare professionals. We've got new rare disease collaborative networks. We've got rare disease therapies coming through ILAP. And we've got continued upscaling of the volume that the genomics medicine service can process, and the extension of the numbers of different conditions which are screened for. This year, we were very much focused on delivering it against existing actions, but we also introduced one new and important action, and this is built off a couple of years of work in which we've really sought to bring together the evidence base around the health inequalities experienced by people living with rare conditions. And in this year's action plan, we recognise that people living with rare diseases experience inequalities in their access to health services, and put in place steps to actively address this through NHS England's Health Inequality Framework, Core 20+5. I want to just take a moment to talk not only about what we are delivering, but also how we are doing it. So, patient voice is an underpinning theme of the framework, and it is really central to everything that we do on rare diseases policy. So we have various mechanisms in place to help us to engage people with lived experience and a broad range of stakeholders across the rare diseases community. So we do this via our forum, which meets regularly. We have a broader online platform. We have a patient advisory group, which is convened for us and chaired by Genetic Alliance UK. And that patient advisory group actually sees advanced copies of our action plans as they're being developed, and helps us to develop and to frame them and to improve them. So the underpinning theme of pioneering research, which is what we're focused on as we gather together today, really important for delivery of the UK Rare Diseases Framework. In 2023, we published a report which was the result of around a year of work with research funders across the system to understand what the shape of UK research on rare diseases is, what the different funders are focusing on, and to bring all that together in one place. So we saw that the UK has tremendous strengths in rare disease research. There is a big investment from across government in rare disease research. Also from industry, the life sciences sector playing a really crucial role. And also from charities, a huge investment from charities and from organisations such as LifeArc and from Wellcome. If you haven't seen this report, it's worth having a look at. We cut the data in lots of different ways, so there's a wealth of information in that. But one key thing that I just wanted to bring to everyone's attention now is that there is a focus on rare disease research on a small number of rare conditions, and that we have this long tail of conditions where there is little or no research. And we also saw that while there were these strengths in UK rare disease research, there was also, to agree, fragmentation and people not necessarily thinking about their research and the way in which it connects with other researchers. And that thinking and the work that we did through the Landscape project really fed into Rare Disease Research UK as that was set up, and I think also into LifeArc's thinking as you set up the translational research centres and the way in which you've deliberately taken a different approach to funding rare disease research, bringing together researchers to address common challenges and to work together so that the research equals more than the sum of its parts. So these multi-centre big projects that seek to address common challenges shared across many rare diseases are really important going forward, and to supporting that pull through into the translational research space. So I just want to take a moment now to talk about what this means for people. And here we've got a couple of examples of the direct impacts that have pulled through currently from research projects, but are increasingly going to become the routine standard of care. So on the left, we have baby Freddie, who through the generation study, as a result of his parents making the choice for him to participate in that, was diagnosed early with hereditary retinoblastoma and provided with the chance to receive treatment which will hopefully save his eyesight. And then on the right, Lawrence has already mentioned this case, but we've seen the first treatment of a teenager with Niemann-Pick disease type C at Gosh. So this was the first person to receive an antisense oligonucleotide therapy under this master protocol approval from MHRA. And this is a really, really important step in regulatory terms. So, last slide of my presentation. What comes next? So as many of you know, we're currently in the last year of the UK Rare Diseases Framework. Ministers in autumn of last year agreed to extend the framework through to 2027. Initially, it was supposed to run for 5 years, but recognizing that unmet need remains and recognizing the change that the framework has helped to bring, ministers took the decision to extend the current framework for another year. And they also asked us as officials to bring to them ambitious proposals for what should follow the framework for autumn of this year. So that's something that we are working on now with our colleagues in the devolved nations. We will be engaging with the rare diseases community as we do this. And Genetic Alliance UK are currently playing a leading role in convening stakeholders. We've just had elections in Scotland and in Wales, so we will be working with our devolved counterparts, the other side of those elections, to work further on a cross-UK approach. But we have a current invitation for any feedback and proposals, and really happy to discuss today. You're also very welcome to get in contact with us. We want this to be something that is co-developed going forward. I'm going to leave you, if I may, with an advertisement. Nick Mead is currently busy on a panel in the other session. But we work really closely with Genetic Alliance UK. They're doing an amazing job of convening stakeholders. This is something that we will be engaging with. So they are looking to engage with a broad range of different stakeholders. And I'd encourage you to all look out for this because it will be really key to our thinking as we move forward. Thanks very much.